Okay, go ahead, Scarlet. You can welcome.
Welcome everyone to our Friday Wellness webinar. Today we have a very special experience for everybody. We have two fantastic guests that are going to be taking us through an experience of deepening our understanding of wellness beyond what we oftentimes will think about in terms of wellness and perhaps even integrative medicine. We all know the profound impact that the climate, that environmental health and climate health and planetary health has on our health. And what we'll do today is to take a moment to go a little bit more deeply, to follow the roots of the hurt that we're seeing at a planet level, and to begin to talk about some solutions. But we're going to do that through the lens of one particular issue that's of great importance to us in the US, and you'll learn a lot more in just a few moments. Just wanted to show you our timeline for the Academy of Integrative Health and Medicine. We are the leading organization in integrative medicine, really bringing together an interprofessional representative group of people that are committed to re-envisioning what health and healing can look like for us and for the planet. So thank you for being with us. We're really glad you can join in. Please tell your friends, join and bring colleagues and tell others so that this incredible information can be shared broadly. So I would love to introduce Dr. Brenna Doheny, PhD and MPH. She's the Executive Director of Health Professionals for a Healthy Climate. She received her PhD from Medical University of South Carolina in Marine Biomedicine and Environmental Sciences, where she was studying the effects of environmental endocrine disrupting contaminants on female reproductive tract development through the sentinel species of the American alligator. She obtained that MPH, as you can see, from the University of Minnesota, and her focus currently is on communicating the health impacts of climate change to the public and to policymakers, and fostering community-based strategies to promote mitigation, adaptation, and resilience. I think you're going to be profoundly impacted by what Dr. Doheny has to share today. Our other guest is Dr. Laalitha Surapaneni. Dr. Surapaneni is an assistant professor of internal medicine at the University of Minnesota Medical School. She is a practicing physician who treated patients suffering from COVID during the pandemic in the Twin Cities, and is a member of the Minnesota Health Professionals for a Healthy Climate, and a national board member of Physicians for Social Responsibility. Her areas of interest, as you can see, are the impact of climate change on health, sustainable health care delivery, and how physicians can play an active role in advocating for clean policies that promote planetary health. She's provided testimony to the Minnesota legislature on numerous occasions, and is a science communicator who regularly speaks to media outlets about public health impacts of climate change. So welcome, Laalitha and Brenna. It is a pleasure to be with you. I know that Tabby usually does this part, so I'm Scarlet Soriano. I just wanted to give myself a quick introduction. I am a board member of the Academy of Integrative Health and Medicine, and I am very passionate about climate health, about planetary health, and about the intersection between integrative health and significant impact on planetary health, about how we can mobilize this field to be active change makers in bringing about greater health for our planet. So we will start by introducing, sort of framing the conversation with a short video. Please take a look.
Line 3 is the new Keystone XL Pipeline. If built, the carbon emissions from this pipeline are going to be equal to 50 coal plants every year, every single year. And the carbon footprint of this pipeline alone should be concerning to everybody in the country. This is not just a Minnesota issue, which is why health and science professionals have been warning Minnesota's agencies for several years now.
As a physician, if a patient came to me with alcoholic liver disease or COPD, I wouldn't encourage them to expand or increase the amount of alcohol they drink, nor the amount of tobacco they use. And it's a similar situation here.
I'm a fourth-year medical student.
Second-year medical student.
Current medical student and future physician.
I'm a clinical health psychologist, a medical student and a future physician.
A medical student and future physician.
It is the professional opinion of unbiased scientists and doctors throughout the state that this pipeline will further tie our great state to a future fueled by carbon rather than clean energy alternatives.
This oil does not need to come out of the ground. Contrary to what Enbridge argues, this pipeline will not benefit Minnesota. It will not bring us jobs. The oil will be shipped overseas and the profits will not go into our economy.
Here in Minnesota, we see some of the worst racial health disparities in the entire country. Continuing to make decisions that perpetuate unmitigated climate change is only going to further widen those gaps.
I'm always thinking about questions like, are patients and their families able to rely on fresh food sources and clean water? Are they and their communities safely sheltered? Are they breathing clean air? Do their children have access to safe green spaces?
We cannot continue to exacerbate the climate change crisis through the increased utilization of oil-based products and the destruction of our natural resources.
We have to leave that oil in the ground, and building new pipelines is only encouraging more development and more fossil fuel emissions.
I advocate for and look forward to a future where no water permits for Line 3 will ensure that we are not polluting the sacred land and water of our Native American communities.
Please protect your children and your grandchildren and deny these permits.
We all asked Governor Walz to listen to our health professionals, to listen to our scientists, to listen to Minnesotans. Minnesota deserves a healthy future.
Throughout this process, science has been sidelined and frontline voices have been ignored. The day the IPCC report came out, this pipeline should have been stopped. The day over 100 medical organizations said that climate change is a health emergency, this pipeline should have been stopped. When 12 out of 17 Environmental Justice Committee members resigned, calling this pipeline a war on Black and brown people, that day this pipeline should have been stopped. But we're still here. And today, we're calling on President Biden and his administration to revoke the permits and stop Line 3.
Well, thank you to Brenna and Laalitha for sharing that video. I think it begins to give us an understanding for the lens through which we're going to step into this discussion about wellness. Now, taking into account the larger, the planet health, sort of through the example of Line 3 and its impact, and also our power to be change agents. So before we're going to leave plenty of time for us to have a robust discussion. I really invite people to participate. But both Laalitha and Brenna are going to share some slides with us that are going to give us more information about Line 3, this project, and the impact that it has on Minnesota and in general.
Yes, one moment, I will pull those slides. I don't see them right now. Hold on.
Yes, well, thank you so much, Scarlet. And thank you so much to the wonderful AIHM community for hosting us for this conversation. We're just so happy to be here and to share something with you that is an issue that we're very passionate about, but in a broader sense, also to talk about what we feel is an important aspect of our responsibility as health professionals to, think outside the walls of the health system in which we may practice, and, embrace this larger concept of planetary health, as Scarlett was mentioning, and also to think about ways that we can be involved in kind of taking direct action on climate change through advocacy work. So you had, I think, a good overview of the type of work that we do, and the fantastic team of folks that we have who are involved in that work, who were speaking in the video that you were just able to watch. And so we do have a couple of slides here that we just wanted to walk through that kind of give a little bit more precise information about the Line 3 issue and the work that we have done as health professionals for a healthy climate. So starting here, we just wanted to talk about what is the tar sands oil industry? What is this pipeline system? What are we actually working to oppose here in the US? And you can kind of see already, looking at the source of where these tar sands oil deposits are in the Athabasca River Basin in Alberta, Canada, that this industry it has incredibly disastrous impacts on the landscape. These are the boreal forests, which are rare and very important as an ecosystem for multiple reasons, including that they sequester an incredible amount of carbon. And in order for these deposits of tar sands oils to be extracted, you can kind of look at these before and after pictures and see it involves a lot of deforestation. If you could go to the next slide, please, Jess. Here's a map of the pipeline system by the Canadian company Enbridge that is involved in transporting, so that oil that is extracted from that Athabasca region in Alberta travels great distances through pipelines across the US to refineries and to ports where it could be shipped further. If you kind of see that line from the north heading across the northern part of the US and towards that Great Lakes region, we can zero in on that. That's the area that we're talking about where there is some new infrastructure build currently. This entire system transports at the current capacity approximately 3 million barrels per day of oil from Western Canada to its ultimate destination. So if you want to move to the next slide, Jess. This is what is currently happening. So this Line 3 had been considered to be coming to a stage where it was no longer able to transport oil at capacity due to aging out, so it's aging infrastructure. And we've just been working to replace the entire line, actually, from way up in Canada all the way to its terminal at Lake Superior in Superior, Wisconsin. The upstream portions of it across Canada have already been built and are in place. And the piece, that tiny bit of piece that's from the border of Minnesota across Wisconsin to that terminal has also been constructed. But kind of the remaining part of this new pipeline infrastructure project is what crosses Minnesota. So there is already an existing line here that was built in the 60s, but it is not operating at capacity due to the possibility of failure. Therefore, Enbridge has been seeking permits and was awarded permits to be able to actually replace the system. Not only are they replacing, they are covering a new route that will actually be 337 miles and cross 192 bodies of water across Minnesota, including the headwaters of the Mississippi River, which I'm sure everybody has an understanding of just how extensive the river basin of the Mississippi is and how it's an important source of water for so many areas of our country. Drinking water even. And at this point, about 50% of the construction of this piece across Minnesota has been completed. It began in December, despite years of opposition and a number of legal battles. Currently, this construction is on hiatus just due to seasonal restrictions. If you want to move to the next slide, Jess. So as was mentioned in the video, ultimately, what will happen is that this new line 3, which is actually going to involve larger barrel pipe, will increase the output and the ultimate capacity of this pipeline. And the greenhouse gas emissions that will result from this increased output will be equal to 193 million tons of carbon dioxide equivalents per year. This graph kind of shows what that means in comparison to some different outcomes in the state of Minnesota, but basically the emissions that will be produced by the amount of oil that will be able to be transported through this pipeline is greater than all of the carbon emissions produced by the entire state of Minnesota in 2016. And to put that further into context, if you want to go to the next slide, Jess. This will basically be the equivalent of adding 50 new coal-fired electric power plants. So that's basically a new coal-fired power plant in every state of the US. As I'm sure you've been paying attention, there's a lot of discussion at the federal level of trying to actually eliminate coal-fired power plants because coal is a very problematic energy source due to its carbon emissions. So the idea of creating the equivalent amount of emissions to building 50 new coal-fired power plants is really staggering. If you would like to move to the next slide. So why we think about this as a health issue, I'm sure this audience is already well aware, but air pollution is a killer. And so much of that air pollution is due to the combustion of fossil fuels. There's been a study that was released pretty recently that hit a lot of major news sources and was getting some press, but they concluded that just the combustion of fossil fuels and the emissions there caused 8.7 million deaths globally in 2018, which is staggering. They also have looked at it kind of from the other direction, is that if we really got rid of fossil fuels, we're no longer combusting them as an energy source, we'd increase the average life expectancy of the world population by more than a year across the entire global population, which is a huge number to think about. And of course, then it would also reduce healthcare costs by a staggering $2.9 trillion. So there's a lot of reasons why adding 193 million carbon dioxide equivalents of emissions to the atmosphere every year is highly problematic and poses an unacceptable health risk. If you'd like to go to the next slide, Jess. And I'm pretty sure that everyone here has some of the general background and understanding all of the impacts of climate change on health. This is a helpful graphic from the Medical Society Consortium on Climate and Health that shows some of these regional impacts. But ultimately, our warming climate causes more extreme weather events, changes in precipitation, increased risk of wildfires. It has impacts on food production, impacts on the incidence and range of disease vectors. I mean, there's multiple impacts across the board, and it's also important to think about the health impacts on mental health as well. So again, line 3 and the amounts of fossil fuel that will be enabled through this expanded infrastructure will exacerbate all of these health impacts of climate change. Next slide, please. There's also a direct risk, of course, of a spill from the pipeline into all of these water resources. Minnesota is known as the land of 10,000 lakes for a reason. We have a lot of freshwater bodies across the state. You can see on the right, that map kind of models, all of the areas where there'd be a potential for oil to leak from this pipeline into a water resource. And this particular tar sands oil is more problematic for spill into water bodies because it's actually a heavier, denser type of oil called bitumen, which is different from the sweet crude oil that you might remember from like the Gulf oil spill from the Deepwater Horizon. That was crude sweet oil, which floats to the surface of a water body and can be cleaned to some extent using different types of surfactants, but dilbit will actually sink to the bottom of water bodies. And there's also some interaction with the colder temperatures that are in this area as well. So it makes cleaning it very difficult. Another aspect of this is that this type of oil also is mixed with a diluent, so that will flow through these pipelines and be more easy to transport. That diluent is actually a proprietary formula, so it's not well known completely what's in it, but there's a lot of compounds that are known carcinogens that are included in that. And areas where spills have occurred into water bodies, there have been a lot of acute and also potentially chronic health effects just from largely from all of those carcinogenic chemicals that are in that diluent. Next, please. And of course, this always comes down to, as with climate change in general, this is an environmental justice issue. The health impacts and all the other impacts of this pipeline and of the tar sands industry disproportionately harm already marginalized communities, especially Indigenous communities. So the fact that this pipeline is being built across treaty lands is a violation of tribal sovereignty in Minnesota. As was shown in our video, many of the tribes in Minnesota have been leading opposition to this pipeline since its inception. They're concerned about how it will impact a lot of important cultural resources, including wild rice, which is a very critical resource for the Anishinaabe people of Minnesota. It has incredible importance both as a food resource and as a cultural and spiritual resource. What's important to note is that the pipeline does, you see this new route was specifically made so it doesn't directly cross across any of the reservation lands, but this large green area here is actually treaty territory of the Anishinaabe people. So this is land at which they reserve the rights to hunt, fish, to gather food, to practice other important aspects of their culture. And so it's absolutely a violation of tribal sovereignty that this pipeline is crossing those lands. Next slide, please. And another important impact to consider is gender-based violence. There is an epidemic of missing and murdered Indigenous women and relatives for, unfortunately, many reasons that also go into other aspects of criminal justice, how these issues are treated. But there is a direct connection that was documented in this national report in Canada in 2019 that showed a strong correlation between the types of camps that are set up for extractive industries like tar sands oil production and increased violence against Indigenous women and relatives. And so the Indigenous groups that were protesting this pipeline crossing Minnesota brought this up as a major concern. And that was another one of the issues that has been ignored throughout the permitting process. And already since the construction began on the pipeline in Minnesota, there have been 2 arrests in a sex trafficking sting that were Enbridge pipeline workers. There have been other reports documented in different news articles of just different types of sexual harassment that are happening in these small rural communities along the construction route. So this is a very real threat, and it's important that we also recognize this as a health impact to vulnerable communities. Next slide, please. And I think that next we were going to talk a little bit more about the types of advocacy work that we have been doing around this issue as a community of health professionals. And I believe Laalitha is going to join us to speak about that.
Yeah, thank you. Thank you, Brenna, for laying that out very well. And I see a couple of questions in the chat, and maybe I'll just briefly answer them before I move on to this slide. So, first question was, how many leaks of pipelines have there been? And Jess, I was just wondering, I just put a link in the chat. Are you able to pull that up and share your screen with us? You know, the company that, and this, oh, thank you, that was really fast. You know, this map was created by one of the scientists who's been working in coalition to oppose the Line 3 pipeline. And so if you start to kind of like scroll a little bit further down that map, I think it shows you, you know, this is the mining of tar sands. And then if you scroll just a little bit more, those ponds that you just saw are where they store the toxic water. And so this shows a, you know, just a map of all the pipelines. And if you scroll just a little bit more, you should see that's all the pipeline spills in the, and this has been data that's, you know, data sources are reported right there. And this map has been constructed based on that data. And, you know, as far as Enbridge goes, they take the credit for both the largest oil spill as well as the costliest oil spill, inland oil spill in the US. So the largest oil spill was actually in Minnesota, in Grand Rapids. And we recently celebrated the 30-year anniversary of that spill. The costliest inland spill happened into the Kalamazoo River. And I think Brenna, you know, in the slides, one of the slides that we had on oil spills, that shows a picture where, you know, in Michigan, there was an oil spill. So, you know, when we say, and then the other question I think was, has it been shown that new pipelines leak less? And that is what the company will claim, is that, you know, this is such an old pipeline and it's leaking. And so, you know, we need to replace it. But in fact, Greenpeace did a report on it, and they looked at the pipelines that have been constructed in the past decade. And what they found was that no, they don't, there's no data to show that newer pipelines leak less. And in fact, very paradoxically, you know, there's a pipeline safety federal body, and they put out PMHSA, I think, or PHMSA. So they put out this report, or like almost like an alert, saying that one of the biggest reasons why pipelines leak is because of flooding. And, you know, when you put the pipe in the ground and there's a lot of flooding, that kind of moves, disrupts the integrity of the pipeline. And what's so like ironic and paradoxical about this is that for the Midwest, especially, climate change is supposed to be, you know, bringing us massive precipitation. So we are, you know, just making these oil spills more likely by burning more oil. And I think there's, the last question was, isn't the water pollution from leakage of existing pipes? Yeah, I mean, that is also a concern. But what we've been, you know, advocating for is that because pipelines leak by their nature, shouldn't that just be another motivation for us to continue to, you know, move away from building pipelines and switch over to cleaner energy, instead of trying to, you know, do the things that we know are, you know, we know pipelines leak, so why are we just continuing to follow that same pattern? And I think there was another question about rail versus, you know, oil transport via pipelines. And that is also another argument that Enbridge made, you know, at this very Public Utilities Commission that I'm going to talk about, is that it's more climate friendly to transport oil via pipeline as opposed to transporting it through oil trains or trucks. I mean, sure, yeah. I mean, that if you're just comparing how many emissions that we're going to be producing for the mode of transport, then pipelines are have a lesser carbon footprint from that standpoint. But ultimately, it's the oil that we're talking about. And there have been really bad accidents with rail accidents where the oil tankers just, have derailed and caused, I think the worst one that I'm aware of is in Canada. And I'm not sure I'm going to pronounce the name of the town very properly, but it's Lac Megantic, where a train was parked and then there was an emergency brake that malfunctioned, and oil tankers just rolled into the town and decimated, like the entire town burned down. And bringing it back to the wellness and just thinking about things more globally than just what's happening right in front of us. I think when they've studied populations who lived there and who went through this horrific disaster, they've seen a rise in depression, a rise in alcoholism, and just PTSD from how their community was impacted. I got to know more about rail transport issues because when I was in Baltimore, we were fighting crude oil trains there. So yeah, and I'll just kind of fill you in all about what we've done as health professionals in Minnesota specific to Line 3. So, I have to preface it by saying that I am just only one person of hundreds of health professionals and scientists with very varied expertise who came to the table to work in an interdisciplinary fashion to provide arguments for why this pipeline affects, a particular part of the entire ecosystem that we live in. Of course, as health professionals, we spoke about human health. Some of the people you see on that picture are hydrologists, geologists, entomologists, we've had physicists, a lot of people who came to the Public Utilities Commission to talk about the harms of this pipeline. In Minnesota, wherever we have like this large energy projects like a pipeline or a coal plant or whatever the big energy project is, they have to get permits from a variety of regulatory agencies. So that would be, they have the Public Utilities Commission, which has to determine the need for that energy, for that oil. Then we had the Pollution Control Agency, who looks at, what's the harm to human health, to public health. Then we have the Department of Natural Resources, who's looking at more the harms to land and ecosystems. So then we had our governor who oversees all of these agencies. So we were at the Public Utilities Commission and we testified about how, climate change is a health emergency and that we need to be moving away from building these pipelines. Jess, if we could go to the next slide. Then this was around, as you saw in the video, we had health professionals visiting with the governor's office, talking specifically about findings in a white paper that we wrote about the health impacts of various health impacts that Brenna just talked about. We had scientists and youth visit the governor's office, talking with them about why this pipeline would be a climate disaster. We had, we wrote letters to the editor, op-eds, and communicated in various ways to the governor and their staff about the need to stop this pipeline. And most, the one step before we went into construction was during the pandemic. And that's when we were talking about, projections of possibly spread of COVID with workers who will be traveling from out of state to come stay in rural Minnesota. And just next slide. And, this was also Minnesota Pollution Control Agency. They were the ones who had to give the water permits. So as you saw in the video, we had medical students and health professionals who engaged in speaking with, the Pollution Control Agency's commissioner. We also did speak with the media and created these posters that were, science communication, speaking to the importance of wetlands and water bodies and kind of correlating that to human health and human body. And when the pipeline permits were finally given, that was in end of November, right before construction started, 12 of 17 Environmental Justice Committee advisory group for the Pollution Control Agency resigned, as you saw in that video. And then the last slide, and construction started. This is one of the locations where it's close to the headwaters of the Mississippi. This was earlier in spring when the river was just starting to thaw. So you can see the drill site is actually very close to that particular section of the river that you're seeing. And where we're standing in front of, we're standing in this path. The trees behind us, there were trees and forests, and that had been cut down in order to make way for equipment to start construction of the pipeline. So that's my last slide, and that's where we find ourselves is, continuing to work in this movement where Indigenous leaders are leading the movement and, adding our expertise as health professionals wherever we are, called upon to do so. And right now we're working with national organizations, and thank you so much, Scarlet and AIHM, for giving us the space to raise awareness. And I think, as Brenna said in the beginning, not only about the details of Line 3 and how this is a really bad idea, bad pipeline to be building at this point in our climate crisis, but also making sure we create that space for, how can health professionals engage in this? Why is this our lane? This is where we need to speak up. And I hope the questions, will bring about some of that conversation.
Thank you so much, Brenna and Laalitha, for bringing this issue to light. There's so much to explore and unpack here. One of the things that I was listening to a presentation yesterday by Dr. Sylvia Earle, who many know as a real pioneer in deep ocean exploration and tremendous environmentalist. And she said something, and a lot of the same themes sort of come up in the conversations around the health of our oceans, which is another area that's of extraordinary ill health and sort of abusive practices by us. And she made a comment, which was, people don't want to look. We'd rather look the other way. And I felt it in my heart when she said that, because of many reasons. And one of the reasons that immediately comes to my mind and being is that it's painful. That when we begin to understand what we are what we're riding on, it's like we're on a train, to continue with this transportation, images, we're on a train, but some of us, a few of us, are able not to look out and see what the train is riding on. There are many others who don't have that, right? The train is going right on their bodies and beings and spaces. And so how then do we begin to look? And how then, when we look, begin to become engaged in a way that is infused with energy, with community, with enthusiasm, and that isn't about shame and about guilt. So I know that's a lot, you can both take it, but the real kind of gist of it is, how do we get people to look, and how do we do so without needing to step into shame and guilt?
Yeah, thank you so much for that question, Scarlett. That's something that I honestly think about and grapple with all the time through my own personal trajectory as an environmental health scientist. I think that at least that ability to look comes with the territory in a sense. Like that's the knowledge that I was interested in investigating, understanding environmental health. So that piece, I guess, has not been an issue that I struggle with per se. It's the unbearable weight of the knowledge once you have it, once you see it. That's been something that I've found very challenging to deal with. And particularly in, I think it was 2018 was when there was a more recent report of the Intergovernmental Panel on Climate Change was released, and a lot of the media coverage was referring to these very dire predictions that by 2050 we could see like 95% of the world's coral reefs gone, just completely decimated. You know, it was just laying out these sort of doomsday concepts of what the world is going to look like. And that really staggered me for a while. And, you know, I think that we all experience a lot of despair and grief around climate change. In fact, there's a word for that, solastalgia. It's the concept of honestly being homesick for your home, even though you're actually there, because it is altered so much that you no longer recognize it. And we're all dealing with that and grappling with it. So to get to your actual question, which is what do we do? What we do is we come together and organize. I hope that that has come through in what we've been presenting so far. But for me, dealing with that grief, what I did is I found health professionals for Healthy Climate, and I became involved with all of these wonderful peers. And then we looked at, you know, where do we think we can actually make an impact? You know, what's happening right here in our backyard? That's why this issue about the Line 3 pipeline is so important to us. It really fits with sort of that concept of, you know, act locally and think globally, because this is something that's happening here in Minnesota to our communities, but also, you know, the end results of this increased, you know, this expanded infrastructure for fossil fuels is going to have these dramatic global impacts. So that is, I guess, my advice is, you know, find people to work with, you know, support each other, find your front line, you know, whatever it is close to you, and you know, it can be discouraging work, but, you know, the difference is, you know, once the knowledge is there, it's worse to look away, right? You know, we need to keep acting, and really having that support from community is very important. And it's also part of the solution, right? The more we create community and care about each other, the more we are actually going to solve these problems. A lot of them have to do with that disconnect that you alluded to, you know, looking away, not recognizing how interconnected we all are.
Thank you so much. I just, you know, the image that comes to me, Brenna, as I was hearing you speak, is this image that of, you know, sort of myself looking, and the difference between me looking alone and me looking with other people's hands holding mine, right? When we are hand to 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 hand across a variety of different walks of life and skill sets and ideas and backgrounds, the solutions that can come through are shared. And it doesn't feel so weighty, as you said. It feels that this is ours, and we are here to help it. So in that spirit, what do you both feel are concrete things that health professionals, and in particular, if you can, people in integrative health who tend to really think mind, body, and spirit, can do to support this particular issue as part of their engagement in the world and sort of wellness in a larger kind of expression? What are some concrete things?
Yeah, I'm trying to think about the last question still, Scarlet, about like the shame and guilt and how that leads then into sadness, but then how do you then not go to despair, but then turn that into fuel for action, right? I think one of the kind of biggest realizations probably for us to collectively come to is that so many of the individual actions that we do are because of the way our systems are built, So it's not like, if there were an electric car, I would take it. If there's an electric flight, I would take it. Everyone would take it, right? And so we've built this world, and we are almost like, if you go to the grocery store, you have to get something wrapped in plastic. And so then if we feel guilty, we're almost set up to fail. And then we will feel guilty. And then we're like, okay, fine, I'm not going to worry about this because it's too hard to do. And so I think it's realizing that role that systems play, and how can we act to change those systems. And I think that's where the action comes from, is, first having the realization that destruction of the environment plays a role, and maybe talking about that grief, and removing the judgment from it. So because you got a plastic bag, you got a plastic cup from Starbucks, like, who are you to criticize the current status quo? I think that's that's a point of argument that works for industry really well, right? Because they want people to not be doing anything about this. But I think acknowledging the fact that, yes, this is very painful. Yes, we're doing this to ourselves. And then what do we do about it? Removing that judgment and trying to understand these systems and where those levers are that we can pull, I think is very important, like common space that we need to be before we step onto like specific actions for each project, right? And I think for me personally, like what I've found the most helpful way of like first step to taking action is going and interacting with frontline communities and asking them, how can I help? Instead of sitting in a classroom and coming up with, oh, I read like 50 papers and, air pollution impacts health, so let me just like go do a study. Instead of like that approach that we have as academics to just get more specific of our projects and not very like general about themes. So for example, first, where I heard about this whole thing, whole Line 3 pipeline was with Minnesota 350 when I first came here. And then, asking them, people who were doing the work of like, where do you think health professionals can play a role? And then kind of fitting that in, I think was very, very helpful to me.
Mm-hmm. I love all your points, Laalitha. And I think that, one thing that is on my mind all the time is that this concept of shame and guilt is a tool to maintain the current power structure that has gotten us to where we're at, right? Because think about it, one person, you reducing your carbon footprint by getting an electric vehicle or something, like, yes, it makes a difference, but how much difference does that make compared to, the expansion of, the tar sands industry through Line 3, right? The carbon emissions that you will save from your driving versus the carbon emissions that pipeline is going to produce, like that's huge. I mean, this is a systems issue, absolutely. And I really appreciate your community, AIHM, and your concept of mind, body, and spirit. I think that is how we do this work, right? Is bringing that perspective of realizing, that level of interconnectedness, and collective action by finding common ground and creating community, supporting that, recognizing a connection between all of us, like I think that you're already well poised to do this work. It seems like a very natural fit and natural progression. I think that what you already do as practitioners is part of this, just include thinking about climate change and part of what you do, and, and that's what you can do to be involved.
And are there petitions, for example, that health professionals, I know that Jess has put link, and I saw a couple of comments, a couple of questions. I will definitely bring those up next. Thank you, Jess. But I know that there was a link to a document that has sort of a variety of resources. Can you kind of walk us through that? Or if I am a health professional, where do I find a flyer? Where, if I want to bring this into my journal club with my residents, or if I want to, whatever it might be, if I want to be active, what are some concrete actions that would support you if I would like to get involved?
Yeah, I think the Google Doc, Jess, if you want to bring that up, we can certainly go over that. There are a lot of, questions here that I definitely want to try to answer some of them here. So I guess another kind of thing that I wanted to make sure that I bring up same along that line of like taking action. And Scarlet, what you said, I think was really important, is that we all have like a role to play. And so it's an interdisciplinary approach, right? And movements usually are not going to happen just by everyone working on the same kind of point, like the levers that we talked about. And so I think it's very essential to, yes, there needs to be research that, and so we need scientists who are doing that basic work. We also need science communicators. We need, community activists and advocates. We need organizers. So I think when you look at this document specifically, I would encourage people to like find out where you fall into this. And, just because a certain action is being elevated at this time doesn't mean that, and if you feel like you don't fit in, doesn't mean that we don't take action, So for example, if we go back to the top. So yeah, I think we have our resources here. And honestly, Brenna, you put together the documents. I feel like you should walk people through this.
Yeah. Sure. I think that, it comes down to there are ideas of if you wanted to specifically join in action to help oppose the construction of Line 3, that's one thing. There's been direct action that has been led predominantly by Indigenous water protectors, since construction began. They need financial support. A number of folks are having legal issues because there have been arrests. There's legal funds you can contribute to, or funds for supplies, those kinds of things, if that's work that appeals to you. As Laalitha was saying, it's find where you think that you can make an impact and what resonates with you. So those are some direct needs, but there's this larger issue of the tar sands oil industry and fossil fuels in general. Really, if we're going to make a dent to try to reduce climate change impacts, we need to reduce the ultimate output, right, of fossil fuels. And so that involves divestment from the fossil fuel industry. So there is a major campaign to defund Line 3 that's happening. We have links posted to all of these organizations in this document that we've shared a link for you that you can kind of page through. But divestment, there's this large movement targeting major banks and financial management services that are known to fund Line 3, but Line 3 and Enbridge aren't the only fossil fuel companies that are trying to invest in further infrastructure buildouts, right? There's others as well. And so you might find that your own institution, your health system, or the university you work for, like, where do they invest their pension funds or, other funds? Are they also funding fossil fuel expansion? You can start a divestment campaign in your own sphere of influence. That was what I was sort of alluding to earlier and saying this, this concept of find your front line. Like, that's a common phrase that's used in the world of grassroots organizing. It's just, where is the place that is close to you that you can make an impact, that you can rally people around? But divestment's a great place to start. So those are ways to kind of directly get involved in this pipeline fight right now. And yes, ultimately, as far as ending construction of Line 3, there are some legal battles ongoing with the permits that were issued by Minnesota state agencies. If appeals are granted, that will delay construction further potentially. But also there's federal authority. You may have heard that on his first day in office, Joe Biden issued an executive order to stop the Keystone XL Pipeline, which is another oil pipeline that has been a source of contention for many years. And he could also issue an executive order to stop the construction of Line 3. So we do have an ongoing petition from health professionals that we will be sending to Joe Biden. There's other larger national petitions as well that are ongoing. And of course, we always recommend just reaching out to decision makers. If you use social media, you could be sending those type of social media messages to the Biden administration at any point. But any opportunity you have to communicate with policymakers to make them aware of this issue and aware of how you feel about the issue as their constituent, that's your power. Use your power as a constituent, exercise our democratic rights.
Thank you, Brenna and Laalitha. I know that we are right at the top of the hour, so we only have just a couple of minutes left. And I first want to thank you. I want to just really appreciate the commitment that exudes from you to making the world a better place, to living your vocation, to living your being part of this living system, and to inspiring others. I certainly feel really inspired and mobilized by you, and will take action and find my front line and continue to spark conversation around these issues. I know we had a couple of comments. I apologize to the person that made those comments. We won't be able to kind of go into them, but I just want to highlight that there were some really thoughtful comments about quality control issues and impairment of judgment and substance use, as well as the use of physicians for expert testimony, which you also talked about, all of which are really important issues. So thank you to Renee Lyons who brought these points up. I wanted to also just mention that one of the things that helps me as I think about wellness, my own wellness, sort of wellness and engagement and social justice work, and where health and equity in my eyes become one, where I realize that you can't have one without the other, right? You can't have unequal experiences, inequitable experiences in health at the same time, is to come back to my heart. So I just wanted to offer that as a sort of closing frame, at least from my perspective, and invite your perspectives as well. I know that I must center in my heart, and I need to connect with a level of love for myself, for the planet, and for all others, even those who seem to be on the other side of an issue, and perhaps especially those that seem to be on the other side of an issue from me. Because when I connect to that remembrance that we are one, then I access greater wisdom, and I'm sort of I magnetize towards me people who can further me along. So I just wanted to offer that, and if you have any comments, then please go right ahead. But I wanted to leave that energy as a fuel for all of us.
I love that. Thank you so much, Scarlett. And thank you also for making that point that, oftentimes an issue like this gets really contentious, and it seems like, there becomes that opposition, that binary. But I think that that's the value that we as health professionals bring to these issues, is that we are looking at it from the central concept of we care about everybody's health and well-being, both now and in the future. So, I myself am a resident of a rural community in Minnesota, and one of the main, the arguments in favor of this pipeline construction is, revitalization of rural economies and communities, that they're suffering and they need jobs and all of that. And I, of course, am super empathetic to that. I mean, these are my neighbors, my community. I feel that too. And so, all of this is looking at the threat of climate change, we need to be thinking about how do we come together to create a better future for everyone? How do we create jobs and revitalize the economy in ways that are beneficial, that are not extractive and exploitative? Doing this work in trying to stop the expansion of the fossil fuel industry is work that is caring about those communities who feel like they, need those jobs. Like we're doing it for them too. It's everybody.
That's right. That begins to close those divides. We will go ahead and shift to just a final slide, but Laalitha, I don't know if you have any final comments or anything you wanted to say.
No, I think Brenna said it. Yeah, said it all. Yeah, thank you.
Well, thank you so much, everyone. We hope that this has been a conversation that has opened some windows within you and opened you up to sort of a more expanded sense of what wellness can mean, and an activated sense of agency in bringing about the wellness that all of us need in order for all of us to thrive. I really want to leave us with this, what Brenna so beautifully stated, that this is for everybody, and that the more we begin to close the gaps across positionality, the more we're able to and see each other as humans and see each other as sharing a precious planet, the more we'll be able to find perhaps solutions that would never have come about if we stayed only within our own positions. So I invite discussion, I invite conversation. Join us for our Monday morning meditation that's coming up this Monday with Sandra Amado from the Cohort 1 Fellowship. For those of you fellows, I remember her. And she's magnificent. And also we invite you, we will not have, the next event that we are going to have is going to be on May 14th, and that's going to be the AIHM Fellowship graduation for Cohort 6, which is amazing that we're already graduating Cohort 6. So we hope to see you there, and please connect with us. Please keep watching our webinars. Become a member if you're not a member. Tell your colleagues, tell the students and learners around you. This is an interprofessional organization with a very strong commitment to equity and to really reimagining our world so that it's truly healthy in the largest sense possible, mind, body, and spirit, and planet for all. Thank you so much.